Introduction. Hello, my name is Katoma and this is my partner Sarah. Today we'll be discussing fentanyl, a powerful synthetic opioid that plays a major role in the current overdose epidemic. We'll explore what fentanyl is, how it's used, its short-term and long-term effects, and treatment options available for individuals affected. Fentanyl has reshaped public health discussions due to its potency and widespread presence in illicit drug markets. Next up will be the official and street names. The official pharmaceutical name is fentanyl citrate. Common street or slang names include Apache, Dance Fever, China Girl, Murder 8, Jackpot, and finally Tango and Cash. Users and dealers often shorten it to Fent, Fenty, or just synthetic heroin. Recognizing these names is crucial because fentanyl is often disguised or mixed into other drugs without users' knowledge. Now we have the appearance of fentanyl. Fentanyl comes in many forms: prescription patches, lozenges, powders, and counterfeit pills. Illicit fentanyl can be nearly indistinguishable from genuine medications like oxycodone or Xanax. And in the picture, we have 3 forms of fentanyl, which would be pills, powders, and fentanyl citrate injection. And now we have how fentanyl is used. Medically, fentanyl is used to manage severe pain, especially in cancer patients, through patches, injections, or lozenges. Illicitly, it's smoked, snorted, swallowed, or injected, often without users realizing they're taking it. The problem is that fentanyl is 50 times more potent than heroin and 100 times more potent than morphine, making even microgram amounts potentially lethal. And now for my last part of the presentation, I will be speaking about short-term effects. Physical effects may include euphoria or a strong rush, sedation, drowsiness, or nodding off, constricted pinpoint pupils, reduced respiration and risk of a respiratory arrest, nausea, vomiting, constipation, flushing of the skin, dizziness, confusion. And some of the psychological effects include a sense of relaxation or detachment, confusion or impaired cognition, in some cases hallucinations, especially at high doses or with analogs, the risk of overdose. Because fentanyl is so potent and often unknowingly consumed, overdoses can occur rapidly, sometimes within minutes. Many deaths involve respiratory depression and loss of consciousness. Now I'm going to hand it off to Sarah, who will be finishing up our presentation for us.
Hi guys, this is Sarah, so I'll be taking over the rest of the presentation on fentanyl use. So to get started, we will be going over the long-term use of fentanyl. This does both affect physical and mental aspects of the human body. So physically, you build up a dependence, a less effective pain relief, your immune system gets shocked and suppressed, which leads to an increased risk of being sick from viruses and infections. Insomnia or other sleep problems and fatigue are very common, chronic constipation and gastroenterologist issues. This has a major impact on hormone levels, which can all lead to reduced sex drive, infertility, erectile dysfunction, or menstrual cycle changes. And then you are at a higher risk of overdose. Mentally and emotionally, there's increased irritability or mood swings. There's a lack of motivation or interest in previously enjoyed activities. This can also lead into guilt and shame, depression and anxiety, cognitive impairment, psychological dependence, and then paranoia and hallucinations, which all can lead back into higher or increased suicidal thoughts or behaviors. For long-term use, the body basically becomes so dependent on fentanyl to feel normal, and that can make it very hard to start recovery options. And just before we get into the prevalence use of fentanyl, there was actually a research study that was done in 2020, And the study looked at how people's online behaviors might be connected to the growing fentanyl crisis. And so a researcher actually compared Google searches for the word fentanyl with overdose death rates across different states in the United States. And so they actually found that states where people searched for fentanyl more often had a higher overdose death, especially in areas that had a high use or search for heroin. And so the study proposed that the idea of online search trends could actually help predict overdose spikes before they happen. And the researchers suggest that search engines like Google, Yahoo, even ChatGPT could display warning messages or links to hotlines wherever someone searches for fentanyl or other dangerous drugs. And it's a kind of creative and modern approach to help harm reduction by using technology and digital data to reach people just before it's too late. So much like when people search anything related to self-harm, suicidal, depression, the crisis hotline immediately pops up with other resources to help see if it'll help reduce that harm before it happens to the people that are searching it. So it's the same thing that they were wanting to do in terms of substance abuse, to just offer the resources, possibly just online resources in their area based on state and location, to see if it can help just reduce the overdose death rates and fentanyl use in general. So now we're getting into the prevalence of use, and fentanyl is actually one of the leading drivers of the opioid drug crisis in the United States. The CDC had done a report that showed over 70% of opioid drug overdoses deaths were from synthetic opioids, but fentanyl was the primary drug in 2022, and we can actually see on the chart that's next to this just how much it had skyrocketed in general in the United States after 2012, but specifically from 2020 to 2022 when the study was done, fentanyl had a major increase. And so illicit fentanyl is found in counterfeit pills, heroin, cocaine, and methamphetamines, which causes unintentional exposure because more times than not, people do not know that it's been laced in other drugs that they are using, since it's basically odorless, colorless, and it's so cheap to manufacture that it's easier to get it into other drugs and expose people. And a lethal dose of illicit fentanyl can be as little as 2 milligrams, and that is the equivalent of just a few grains of salt. So it does not take much to cause an overdose. So now getting into fentanyl overdose. So signs of an overdose include pinpoint pupils, face being extremely pale, cold, or clammy, the body going limp, fingernails or lips have a blue color, there's vomiting or gargling noises, if a person can't be awakened or is unable to speak, and then breathing or heartbeat slows or stops. And so in that situation, what can be done is to call 911 immediately, attempt to wake the person up, and in fentanyl cases, if Narcan's available, to administer it. You also need to start rescue breathing and or CPR. And if convulsions begin, turn the person on their side and stabilize their body to avoid any choking and preventing them from harming themselves any further. And then staying with the person until paramedics arrive. And kind of just some research on the opioid overdose crisis, as it gets mentioned many times throughout not just this presentation, but probably many others. In 2019, there was actually a study that showed that global spread of illicitly manufactured fentanyl was at large-scale production and trafficking, which was making the drug more accessible and dangerous worldwide. So that researcher had actually emphasized how weak international regulations and the online markets allowed fentanyl to circulate far beyond medical use, reaching communities across multiple continents. And then there was actually another research study done in 2021 that defined a fourth wave of the opioid crisis, which was marked by fentanyl being increasingly mixed with stimulants like methamphetamines or cocaine in the United States. And this combination led to a high rise in polysubstance overdoses, which individuals also didn't realize that their drugs contained fentanyl since it was so easy and took so little to mix into other drugs. And so together these research articles just suggest that the global manufacturing and traffic of fentanyl contributes to a major border shift in like the drug supply, laying the groundwork for the fourth wave of the opioid crisis to expand fentanyl's reach and risk with domestic markets. And just to end on fentanyl overdose, so naloxone is actually a medication that can quickly reverse an opioid overdose, whether that's from heroin, fentanyl, or other prescription opioids, and it's commonly given as a nasal spray, making it pretty safe and easy to administer for non-trained individuals, but it's also available in an injectable. And so this medication helps reduce a opioid overdose fast by stopping the drug's effects on the brain. And so this can help restore normal breathing within just a few minutes of someone whose breathing was slow or stopped due to opioid use. And so when stronger opioids such as fentanyl are involved, more than one dose may sometimes be needed. But the great thing is in 2023, Narcan, which is a very common nasal spray, became one of the very first opioid overdose reversal medications that was approved for over-the-counter use by the FDA, since it was only available as a prescription since 2015. It was very easy to get a prescription, but you still had to go to a pharmacist to gather it. So it being over-the-counter now for anybody to have has played a great role in stopping overdoses before they get too far. And so while there's not any data available on how many overdoses the Narcan has reversed, the CDC says that bystanders are present in about 46 of overdose deaths and could potentially save lives by carrying and administering the medication. So it being available over the counter has great hope for stopping many overdoses from getting to the death rates. And so going on to withdrawal symptoms, so these can include muscle and joint pain, insomnia, anxiety and depression, nausea, vomiting, and diarrhea, dilated pupils, runny nose, watery eyes, and increased heart rate and blood pressure, irritability, and just generalized weakness when stopping opioid use, such as fentanyl. So getting into medication options for treatment. So typically most people going through opioid use disorder treatment do MAT or medication assisted treatment. So this is just FDA approved medicines that are combined with counseling and behavioral therapies to treat substance abuse disorders. And so one of those medications is methadone, which is probably the most common and popular one. And so this is a full opioid agonist that binds to the same receptors in the brain that fentanyl would, but it does it at a slower pace and it lasts longer than opioid drugs. And so this helps produce a less intense feeling of euphoria that people seek by reducing the cravings and stabilizing withdrawal symptoms. There's also other medications that just reduce craving and withdrawals. They are some that are opioid blockers, such as the naltrexone, that is mainly used after detox to prevent relapse. And then nafloxidine is approved for treating withdrawal symptoms after suddenly stopping opioids, but this one's typically not a long-term use medication, such as methadone. Moving on to the therapy options of treatment. So therapy and social support is just as vital for recovery as the medications, and using them in combination, like the MAT, shows positive results in recovery. So these options can be very different based on individual specific situations, but it can include inpatient programs, which offer structured environments for detox, therapy, and education to utilize once discharged and doing outpatient treatment. And those outpatient treatment or programs allow clients to live at home while attending therapy sessions, support groups, and ongoing MAT resources. And group counseling is another option that helps build support, reduces isolation, and helps people learn from peers in recovery. It's also a great way for them to connect and not feel so alone in their recovery journey as they meet people that have gone through very similar situations. And some specific therapies that are utilized in treatment options include DBT, which helps reduce self-destructive behaviors and cravings by teaching clients to tolerate distress instead of using substances to escape them. And then family therapy, which can help educate loved ones about addiction, how to rebuild trust, and improving communication and boundaries. And then CBT is another option that can help clients recognize and change negative thought patterns and triggers linked to drug use, such as teaching coping skills for craving and stress. So to finish off the treatment topic with fentanyl, there was actually a research study done in Rhode Island, and it had 150 people in methadone treatment, with about 80% of those people testing positive for fentanyl at intake. So within 12 months, 75% reached remission, meaning they were no longer using opioids. Roughly half of those participants stayed in treatment for the entire year. 50% of those who had used fentanyl and 40% who had not. But nearly all patients who remained in treatment, 99% of them had reached remission, and around 45% maintained long-term recovery. In this study, though, it did have 4 individuals who had left early and had later died. But overall, the study showed that methadone treatment was safe and effective even with repeated fentanyl exposure, and it had helped show that it prevents fatal overdoses. So, as we wrap up the presentation, I'm going to give a few facts about fentanyl. So, the first fact is that fentanyl is actually 50 times more potent than heroin and 100 times more potent than morphine. This is why earlier when it was mentioned as for long-term use there's a less effective pain relief, it is because since it's such a high potent pain relief already, there's not much that can relieve pain once a tolerance is built up. The second fact is that this was created in 1959 by Dr. Paul Janssen for surgical anesthetic, but it wasn't FDA approved in the US until 1968, so almost about 10 years later. And it's still used in hospitals today to manage pain after surgeries, for cancer treatments, or in hospice patients. However, it's typically not the first pain manager that they will choose, and even when choosing it for after surgery pain relief, there's very strict policies in place that help prevent harm reduction and not having patients get addicted to the fentanyl. Fact number 3 is that illicit batches of fentanyl are actually so potent that law enforcement has to use glove and mask when handling evidence, because a person can overdose from simply inhaling airborne powders or by absorbing residue through skin and mucous membranes. And fact 4 is that there are test strips available to check fentanyl on different kinds of drugs or pills. It's done by mixing a small amount of the drug with water, then dipping the strip inside of it. If it's positive for fentanyl, a clear line will appear within minutes. However, the strips aren't guaranteed 100% accurate, just because if that small amount of drug or pill that was used to mix into the water wasn't laced with the fentanyl, it's not going to show up on the test strips, so it can be misleading. Fact number 5 is that fentanyl can be made entirely in labs, which makes it cheap and easy for illegal labs to mass produce and lace into other pills and drugs. So fentanyl is incredibly powerful, both medically and dangerously. While it's been used and created to relieve pain, its misuse has become one of the leading causes of overdose deaths today. And even a small amount can be deadly, and long-term use can deeply impact a person's body, mind, and emotions. So that's why education, awareness, and prevention are very key in helping reduce opioid overdose and substance abuse.